My friend Jed, he has a lower disc issue in his lower back. So what we're going to do today is called Flexion Distraction. So this table is a type of traction to take pressure off of a herniated or bulging disc. And it helps when people are really acute or when they're limping in here and they're really struggling. So what we can do, Jed, if you'll just lay down for me. What we do here is you strap them in like this.
Are we taking off?
We're taking off. And if you just hold onto those black handles for me. So what we want to look for is, with him, I know that this L5 vertebra, he has a history of a disc herniation down through here. So going off of our bedside exam, or if you have MRIs that they bring in, we can tell exactly how that herniation is going. And how I kind of describe a herniation is if it's like a jelly donut with that jelly has kind of come out to the side. And when it comes out to the side, your body perceives that as something foreign and it fights it. So everything gets aggravated and can sometimes even put pressure on a nerve and give that pain that really shoots down people's legs. So what we're doing here is actually going to help take pressure off of that. So we're going to set the cadence here. And well, actually, I'll stand over here so you can see what I'm doing.
Oh, cool.
So we're just going to put pressure on that L5 vertebra that's having that issue.
And this table is moving itself.
Yeah, so it's moving itself, it's automatic. So depending on which way that disc is herniated, we can actually apply pressure to help kind of work it back in. And it's really effective at helping people at that beginning stage when they're really struggling, really limping in here. So basically we would do this for about several minutes, depending on how acute they are. So if they're really, really bad, generally we'll kind of work them up, maybe only do it for 30 seconds to a few minutes. And if as they get better and they're kind of in that medium stage, we don't have to do it as much. What we'll do here, so after you do that for a while, as long as the muscles aren't too tight and they're responding okay, you can actually move into going from a different angle. So this is when it's important to know kind of how that disc is herniated. So what we actually can do here, so say we know with him that disc herniates off to the right. So what you want to do is we come over to the right, and then this just helps work it back into place. So, and as they respond better, as long as they feel okay with it, we go up a little bit faster. So a disc doesn't have veins or arteries that go to it to supply nutrients. It has motion. So motion's so important because it actually helps rush blood into it to get all those nutrients in there. So if something gets stuck, if something's out of line, even in your mid-back that you're having, over time, if that stays stuck, it doesn't get blood flow to it, and those nutrients won't get into the vertebra, and it can actually give people degenerative disc disease, or make that disc really thin where it looks like it's almost bone on bone. So that's why it's important, even if you don't have a disc herniation, to get all these vertebrae moving appropriately and not stuck so they don't dry out and get real thin and desiccate is what it's called. So basically we would do that from one side and then to the other, and that helps get that disc back into the right spot. So for him, he's not in terrible pain today, so we don't want to do too much and make him sore. So I would generally do that for an issue and then make sure that the full alignment is in the right spot.
Okay.
So we have different types of ways to do different kinds of decompression. But this is a really good way when somebody's really acute, really hurting bad, and they maybe can't handle traditional decompression. So while you're here, we'll just loosen you up a little bit. And Jed was also telling me he's an avid weightlifter, and he's been working on his T-spine, his thoracic spine mobility. So I'm just helping him along with that to get everything moving, but also he's doing a lot of work on his own to strengthen up around there, open up his chest, keep all these stability muscles strong, his core strong as well. So yeah, do you have any questions on that?
I see you have what's your function behind you there, and so you were just talking about his points. Can you show us what he's...
Yeah, so we're working on L5 here, so specifically L5 going into the sacrum, the disc that's in between those. So that controls a lot of the sensation coming down into the leg, down into the foot. If you've ever seen somebody who's unfortunately maybe had a drop foot from maybe a stroke or a bad accident, what can happen is if you damage the nerves that control this area here, somebody's no longer able to lift up their foot. And that obviously gets in the way of so many things. So we want to make sure that we help that heal as best we can. So doing it depending on the severity, from a natural standpoint, without drugs, we can help get that moving again, take some of the pressure off of that. Sometimes, we have to work together with somebody's MD or a spine center or an ortho to try to do what we can from a natural standpoint to help them along while they're also seeing somebody for medication, and maybe even surgeries. So.
And if somebody's going to come to you for the first time, you do x-rays, exam, how does that work?
Yeah, so generally when somebody comes in for the first time, we do our exam, and then we'll do inpatient or in-house x-rays at the same time. So we actually have a nice state-of-the-art digital x-ray system in the other room, so we don't have to send anybody out to the hospital or anything. They can just get it all done at the same day. And then depending on the situation, we'll usually use that day to just go over those x-rays, review everything that we had. The next appointment is generally when we go over the x-rays. So my philosophy is I really want people to know what's going on in their body.
Yes.
And if they know like, oh, well, they said that something's going on in my back, I don't know what, I really want to make it my job to educate that patient to know, well, it's this spot on my back, or it's in between my shoulder blades, and I can see on my x-ray that maybe there's a little curve there, or there's a bone spur there, and that way they know it's not just go in, get fixed, and leave and have all these questions. When you know what's going on in your body, you kind of have that power, that knowledge to say, oh, well, I know that I have a lumbar radiculopathy, and I know I need to avoid leaning over in the laundry machine to pick things out because it puts pressure right there. And I know, okay, he showed me that my hips drop down on this side, so maybe I need to move a different way so I don't put pressure on that. And that's when we'll also go into strengthening muscles along with it. So generally,
nobody should go to the chiropractor without x-rays, correct?
That's how I feel, yes.
That's how they found my posterior ponicle.
Yeah, so you never know. Like with a bedside exam, we can figure out a lot. But you never know. There might just be something wrong that you can't feel. So an x-ray really takes all the guesswork out. I don't like to guess, I like to know.
Right.
So being able to see everything really helps, not only with the pain, but try to figure out, well, how can we make this pain go away and also improve the function so it doesn't come back.
Okay.
Yeah, so I definitely love having x-rays and having digital x-rays so we can get those results immediately.